Lots of people throughout the world suffers from different thyroid disorders. As well as examination of thyroid gland is a must know for any examinee of any discipline of medical science. In this video, I will discuss few things regarding thyroid gland examination. And before going to the main discussion, it's time for front page picture. This poster was made to protest violation against doctors in their working places. Here in Bangladesh, every day we come to know that somewhere doctors have been assaulted in their workplace. Maybe this scenario is similar in many other countries, as well as this scenario may be applicable for other professionals too. So, I demand safety of a professional in their workplace. So I think you guys have subscribed my channel, and thank you for subscribing. And let's begin our today's journey. Thyroid gland examination. The disclaimer and the warning shots. Now the typical examination scenario. You will dress yourself and you will go to the examination, and you will greet your examiner as well as your patient, and then your examiner will ask that examine the swelling or front of the neck, and you will hear what have he stated actually, and you will start examining by washing your hands. Okay, now what instruments you need to carry to examine thyroid gland? Okay, first of all, a glass of water. No, you don't need to bring this glass of water. That will be provided by your examination institute. A hammer, a piece of paper, stethoscope, along with the other things, measuring tape, and many more things. Okay. So, as you have asked every question, so now it's time for inspection. So, what things will you inspect? So, you will inspect the faces of the patient, and you know, in this picture, you are seeing that the patient is looking sleepy and lethargic, and there is thinning of the hair. The hair has become thin, and there is loss of eyebrows. The eyebrows have lost in the both outer third of both eyebrows. Okay, the outer third eyebrows has been lost, and the cheeks are flushed. That is very typical. The cheeks are flushed and have a pink orange tinges. It's commonly called a peaches and cream complexion. And you are also seeing that periorbital region is like puffy, or it is called periorbital edema, we usually call. And that picture is typically found in a hypothyroid patient. And that face is typical for hyperthyroid. You are looking that patient is nervous, agitated, as well as there are some eye signs like the upper eyeball we can see above the limbus. Okay, and there is some exophthalmos also. Okay. And then the patient is also looking very skinny or slim. That is also finding. Now the inspection. You know, inspection starts with examining the patient as a whole, the faces, and now the inspection of the proper gland, thyroid gland or the neck. And you need to examine that whether the swelling is one-sided, solitary swelling on the right side or left side, or the swelling is from the both side, the whole swelling there is, or it can be midline swelling. Okay, so anywhere the swelling can be. And if you cannot find any swelling properly, then you need to go for the Pigillo's maneuver. I will demonstrate later on. And after that, you need to look at the extension of the swelling. Extension. And for a thyroid swelling, the lateral extension, this is the thyroid sternocleidomastoid muscle. Okay. This is the left sternocleidomastoid. You are clicking visible. Also, there is a right one. So, the lateral limit of that swelling will be sternocleidomastoid muscle. You know, the thyroid gland lies deep to the sternocleidomastoid muscle, and lateral limit is that one. And there is the suprasternal notch. There is the suprasternal notch, and that lower border of the swelling is above the suprasternal notch. Okay, and if it goes beyond the suprasternal notch, that may be termed as retrosternal goiter. Clear? So completely, usually that swelling lies above the suprasternal notch. And upper limit is not stated properly because it can be very large also. But lateral boundary and the lower boundary is specified. Now, the Pigillos maneuver. Sometimes the swelling by thyroid can be very small and that cannot catch your eyes. If you are asked to examine the neck and if you find nothing, then you need to go for the Pigillos method. So how it is demonstrated? First of all, you need to clench your fingers. Okay. First, you need to clench your fingers, both fingers. Then you need to keep both hands, clenched hands, behind the occiput. And you will ask the patient to extend, and then you will ask for her for deglutition. And that method is called Pigillos method. There are many maneuvers, many names for examining the thyroid gland. You need not to know the names. Okay, some teachers ask the names. What is Pigillos maneuver? What is Kreil's method? What is trial sign? What is von Rempfel sign? Okay, but you need to know what does these findings mean and what is the importance of that findings. Like the one to do the Pigillos method, you will not do the Pigillos in every swelling. If you find that the swelling is visible in your bare eyes, very large swelling, you need not to go for the Pigillos method. Clear? Now, the size of the swelling, and the size will be measured by measuring tape. Okay. And then about the shape. The shape, usually the solitary thyroid nodule, that would be oval in shape. And you know, for the oval shaped swelling, the length will be more than the breadth. Then like that, it will be 5 cm long and 3 cm broad. Clear? And if any swelling is globular, that will be equal 3 cm into 3 cm. Okay. So be cautious. And the whole thyroid gland is butterfly shape. You need not to say the butterfly shape. You will say that is irregular shape or it is. Okay. Then the surface. Surface, it is mainly examined while palpating, but on inspection you can look at the surface also. The surface, solitary surface, is usually smooth and multinodular surface is usually nodular. So that will be demonstrated on the palpation later. The margin. The swelling margin will be well defined or ill defined. It can be regular, it can be irregular. So the margins of that swelling can be visible properly. These are the margins. Okay. This is the margin. So margin is well defined, or it can be regular. Regular, that means smooth outline. Irregular, that means okay, the outline will be irregular. Well defined, that means that you are looking on inspection, you can see that swelling properly. And ill defined, that there is diffuse swelling. Its upper end you cannot see, its lower end you cannot visible. So it will be ill defined. Clear? And now the important thing is technique of deglutition. Now how you will ask the patient to deglutate? Because that is the one test that will differentiate other swellings of the neck from thyroid. Because in neck you can find any other swelling also, lipoma, hemangioma also. So you need to demonstrate, you need to differentiate thyroid from other swellings, and that's the test that will differentiate thyroid from other things. The thyroid swelling will move upwards, need not to say upwards, move while swallowing. Clear? So how to demonstrate? First of all, you need to instruct the patient properly that what are you going to do. Okay, say for example, if you ask that, okay, take a sip and swallow. Then the patient will take and the sip, and he will or she will swallow, and you cannot look that sign properly. So you need to ask her, J, take a sip of water, then hold it. Then when I will ask to swallow, then swallow. First, take water into your mouth, then hold it. Okay, don't swallow. Then swallow when I will ask. Okay, that will be your demonstration or instruction. After that, you will ask that, okay, take water into your mouth, hold it, now swallow. Then you will look, and you will look from the side of the patient, not from the front of the patient. You will look from the side of the patient. Clear? Okay. Sometimes while deglutition, the skin may puckered and pulled up. So that may demonstrate that the patient may be suffering from carcinoma. That is not important, but the technique, the method of examination is very important. That how you have examined the deglutition test. Now, sometimes you will find that swelling is midline swelling, not for the lateral swelling or not for the diffuse or the whole thyroid swelling, butterfly shaped swelling. That is for a small certain nodule in the midline. Okay. So you need to go for the tongue protrusion test also. Okay. So how to do that? First of all, a demonstration that you will ask us that okay, protrude your tongue. So he has protruded, but you have not seen anything. It can be happen. So demonstration is very important in that particular case also. So how will you do this? That you will first ask the patient to extend the neck. First of all, he or she will extend his or her neck. Then you will ask her to open their mouth wide. বড় করে হা করেন। প্রথমে ঘাটটা এক্সটেন্ড করেন, তারপর বড় করে হা করেন। Open the mouth wide. Then after making the mouth wide, then you will ask him or her to move tongue out and in, keeping the mouth open. Clear? তাহলে প্রথমে ঘাটটাকে এক্সটেন্ড করতে বলবো, তারপরে বলবো যে মুখটা বড় করে হা করেন, তারপরে বলবো যে আপনি মুখ খোলা রেখেই হা করেই জিহ্বাটা বাইরে নেন একবার, ভিতরে নেন একবার। তখন তুমি দেখবা ইন্সপেকশন করে, আমরা দেখব যে ইন্সপেকশনের সময় এই সোয়েলিংটা, টাং প্রট্রুশনের সময় এই সোয়েলিংটা উঠানামা করে কিনা। ইন্সপেকশনে, পালপেশনের সময় কিন্তু আমাদেরকে আবার ডিগ্লুটেশন এবং টাং প্রট্রুশন করতে হবে। যদি টাং প্রট্রুশন লাগবে কখন? যখন সোয়েলিংটা হবে হচ্ছে মিড লাইন সোয়েলিং, এর সময়। এবং শুধু মিড লাইন হলে হবে না, এটা আমরা ডিফারেন্সিয়েট করতে চাই থাইরোগ্লোসাল সিস্টকে। এবং থাইরোগ্লোসাল সিস্ট একটু উপর দিকে থাকে, লোয়ার মার্জিনে যদি একটা থাকে মিড লাইন সোয়েলিং, ওকে, এটা মনে করেন নেক, হ্যাঁ, নেকের এই জায়গায় একটা মিড লাইনে থাকলো, মিড লাইন, হ্যাঁ, এখানে থাকলে আমাদের খুব একটা করার প্রয়োজন নেই, কারণ থাইরোগ্লোসাল সিস্টটা থাকে একটু উপরে থাকে। ওকে, তাহলে বুঝতে হবে যে সব টেস্ট কিন্তু সব সময় করা যায় না। সো দ্যাট tongue protrusion should be done in a midline swelling, and that midline swelling should lie at the upper part of the thyroid cartilage. Clear? Not for everybody. Then the other things like condition of the overlying skin, that skin condition can be inflamed. Okay, there are some medical thyroiditis. In that cases, you can find the swelling is inflamed, or there can be scar mark. The scar mark can be traumatic, or that scar mark can be of the previous surgery also. Or there are some visible visible pulsation or visible vein. Visible pulsation, visible vein. These two are very important for that particular region. And another thing that is called the Pemberton sign. That sign is also not applicable for every swelling. You need not to, most of the time, you need not to perform this. But if you find that that patient is having some visible veins, prominent veins in her neck, and his or her swelling is very large, and the lower border has crossed the suprasternal notch, okay, or on history he or she has told that he or she is having some dysphagia or dyspnea or some pressure symptoms or like something. That means in your mind you are thinking that that particular patient may be suffering from retrosternal goiter. In that case, you need to ask for the Pemberton sign. And how to demonstrate this sign? Very simple thing. You will ask this patient to raise. Okay, that is the initial state. Okay, the shoulder or the arms are below. Then you ask the patient to raise their both arms, both shoulder above the neck. Okay, here also that will make the veins more prominent. The veins will get more engrossed or more prominent, and the face will be flushed. Okay, it is erythematous flushed. Okay, it is the normal faces before the test, and that is after raising the shoulders. Okay, that skin are flushed, and the veins have become more prominent. So there's the initial things where you guys will inspect the eye signs, the other findings, or other thyroid acropathy, or there is petiole myxedema. There are lots of things you need to inspect also. That will be demonstrated later on. So I think you guys have understood what I have tried to discuss, and I think that things will be helpful for you guys. And if you find these things helpful, please subscribe my channel, and goodbye for today, and thank you very much for watching.